Thank you. I just want to take a moment to send our best to those affected by Tropical Storm Hilary. As you know, this installment of Walk with the Doc was supposed to be held in person at Spring Mountain National Recreation Area. Unfortunately, we had to cancel due to the storm's impact on Mount Charleston and out of respect for the ongoing recovery efforts there. Our thoughts are with the residents of the mountain, those who are working in the area, and all those affected by the storm. We hope for a speedy recovery and look forward to enjoying the outdoors there again soon. Today, I'd like to talk about ADHD, or attention deficit hyperactivity disorder. ADHD is a neurobiologic condition whose symptoms are also dependent on a child's environment, and now it's one of the most studied conditions of childhood. Research has shown that ADHD may be caused by a number of things. First, brain anatomy and function. There may be a lower level of activity in parts of the brain that control attention and activity level. Second, genes and heredity. ADHD frequently runs in families. A child with ADHD has a 1 in 4 chance of having a parent with ADHD. It's likely that another family member will also have ADHD. And sometimes ADHD is diagnosed in a parent and child at the same time. Other causes of ADHD may include significant head injuries, prematurity, prenatal exposures like alcohol and nicotine, and environmental toxins such as lead. There's no evidence that ADHD is caused by eating too much sugar, food additives, allergies, or immunizations. Almost all children have times when their behavior veers out of control, speeding about in constant motion, making noises nonstop, refusing to wait their turn, crashing into everything around them. Some children may drift as if in a daydream or are unable to pay attention or finish what they start. For children with attention deficit hyperactivity disorder, these behavioral problems are frequent and severe and interfere with their ability to live normal lives. According to national data, ADHD affects nearly 10% of US children ages 2 to 17. It's more common in school aged children. Boys are more than twice as likely to be diagnosed with ADHD. And both boys and girls typically show symptoms of an additional mental disorder. These children may also have learning and language problems. So, why do so many children seem to have ADHD these days? Do more children have ADHD, or are more children just being appropriately diagnosed? It's hard to know for sure, but what we do know is more children are getting treatment for ADHD, and more children are also getting treatment for longer periods. ADHD is a chronic condition of the brain that makes it difficult for children to control behavior. They might be labeled as bad kids or space cadets. Left untreated, it can continue to cause serious lifelong problems, such as poor grades in school, run ins with the law, failed relationships, and inability to keep a job. So, how can you tell if your child has ADHD? ADHD includes three groups of behavior symptoms: one, inattention, two, hyperactivity, and three, impulsivity. Inattention describes someone who often has a hard time paying attention or daydreams, does not like to listen, is easily distracted from work or play, does not seem to care about details and makes careless mistakes, frequently does not follow through on instructions or finish tasks, is disorganized, frequently loses a lot of important things, often forgets things, and frequently avoids doing things that require ongoing mental effort. Hyperactivity refers to someone who is in constant motion as if driven by a motor, cannot stay seated, frequently squirms and fidgets, talks too much, often runs, jumps, and climbs when this is not permitted, and cannot play quietly. And impulsivity means someone who frequently acts and speaks without thinking, may run into the street without looking for traffic first, frequently has trouble taking turns, cannot wait for things, often calls out answers before the question is complete, and frequently interrupts others. These symptoms are usually classified by the following ADHD types: inattentive only, so not overly active, and might go unnoticed as they don't disrupt the classroom or other activities. It's more common in girls. Hyperactive or impulsive, both hyperactive and impulsive behaviors are shown here, but they can pay attention, and it's the least common group and frequently younger. And combined inattentive, hyperactive, and impulsive. So they show a number of symptoms in all three dimensions. And this is the type of ADHD that most people think about. Sound like you or your child? If these symptoms are occurring on a regular basis for greater than 6 months, discuss that with your doctor. Remember, it's normal for all children to show some ADHD symptoms from time to time. It doesn't mean he or she has ADHD. They may be reacting to stress at school or home, they might be bored, or they may just be going through a difficult life stage. And sometimes the teacher is the first to notice. Other times, pediatrician questions raise the issue. If I think my child may have ADHD, how do I find out for sure? Again, talk to your child's teacher or an adult who frequently supervises. Set up an appointment with your pediatrician. And a pediatrician might ask you questions about your child's behavior, how she interacts with other kids and adults, and how she's doing in school. Bring along with you some information from teachers or other adults. ADHD causes problems in more than one environment, not just in school or not just at home. Age is important too. ADHD can be diagnosed as young as 4, but symptoms need to be present before age 12. Written questionnaires may be given. One I like to use is called the Vanderbilt. Parents, teachers, and other adults that supervise may fill it out. Information on these forms can be very helpful to make a diagnosis and to follow treatment. Pediatricians also look for other symptoms that don't fit ADHD. Other disorders can look like ADHD, such as mood disorders, learning problems, and sleep problems. While ADHD can be difficult for children and families, it can be treated. You and your pediatrician can form a treatment plan together. So, you have ADHD. What do you do now? Well, while there's no specific cure for ADHD, there are many treatment options. Treatment should be tailored to meet each child's individual needs. In most cases, ADHD treatment should involve a long term management plan that includes education about ADHD, teamwork among doctors, parents, teachers, other healthcare professionals, and most importantly, the child, target outcomes for behavior. What are the most important behaviors to get under control? For one family, the most important goal may be for the child to do well in school, and for another family, it may be just to sit still at dinner. And follow up activities and monitoring are also important. Treatment may also include medication, parent training in behavior management, individual and family counseling. Before we talk about what may work, let's consider what doesn't work. Despite media reports and advertisements, there's no scientifically proven cure. So be skeptical of megavitamins and mineral supplements, motion sickness medication, biofeedback training to increase brainwave activity, applied kinesiology, or the realigning of bones in the skull, reducing sugar consumption, or optometric vision training, an idea that faulty eye movement and sensitivities cause the behavior problems. None of these are scientifically proven, and they're not recommended. If we're thinking about medications, there are two types: stimulants and non stimulants. For most children, stimulant medications are safe and effective. They may be used alone or in combination with behavior therapy. 80% of children with ADHD treated with stimulants have a great deal of improvement once the right medication and dose is determined. Two forms of stimulants are available: immediate or extended release medications. Immediate release or short acting medications are usually taken every 4 hours when needed and are the cheapest. Extended release or intermediate and long acting medications are usually taken once in the morning. Children can often avoid taking medication at school or after school. Extended release capsules or tablets should not be crushed or chewed, but bead formulations can be opened and sprinkled onto food for those having trouble swallowing pills. Non stimulant medications can be tried when stimulants don't work or cause side effects. It may take some time to find the best medication dosage and schedule. Be patient. Different types of stimulants or other medications may need to be tried. The amount of medication may need to be adjusted. The schedule may also need to be adjusted depending on target outcome. If the goal is to relieve symptoms at school, for example, medication may only need to be taken on school days. Side effects can occur sometimes, but they tend to happen early in treatment, are usually mild and short lived, but may be prolonged or more severe in rare cases. The most common side effects are decreased appetite, weight loss, sleep problems, and social withdrawal. Less common side effects include a rebound effect, or increased activity or bad mood as the medication wears off, transient muscle movements or sounds called tics, and minor growth delay. For non-stimulants, sleep problems are not as common as with stimulants. Initially, it may make a child sleepy or upset the stomach. It can also cause fatigue or decrease in blood pressure. Most side effects can be relieved by changing the medication dose, adjusting the schedule of medication, or using different medication. One concern parents have is whether children are getting high on stimulants, not when taken as directed. At therapeutic doses, stimulants don't sedate or tranquilize and don't increase risk of addiction. Stimulants are classified by the Drug Enforcement Agency, or DEA, as Schedule II drugs, meaning there is abuse potential and use must be supervised closely. Non-stimulants are not Schedule II drugs and do not have abuse potential. Another concern is whether stimulants can be gateway drugs leading to illegal drug or alcohol abuse. People with ADHD are naturally impulsive and risk-taking. Patients taking stimulants are not at greater risk and actually may be at lower risk of using other drugs. Those with ADHD and other coexisting conditions may be at higher risk. So, what can you expect when a child is treated appropriately? Once a child is on medication, monitoring becomes important. Close contact should be maintained with the pediatrician until the best medication and dose are found, then periodic monitoring to maintain best effects. To monitor medication effects, parent and teacher behavior rating scales such as the Vanderbilt may be filled out. Target goals may need to be changed. There may be side effects, and we'll need to monitor height, weight, pulse, and blood pressure. Some medications may not be a good choice for every child. At the beginning of treatment, your pediatrician should help you set target outcomes. These will guide the treatment plan. This should focus on helping your child function as well as possible in all settings. Identify what behaviors are most preventing your child from success. Target outcomes should be realistic, something your child will be able to do, and behaviors that you can observe and count. Examples include improved relationships with parents, siblings, teachers, and friends, better schoolwork, more independence in self-care or homework, improved self-esteem, fewer disruptive behaviors, and safer behavior in the community. Again, the important target outcomes will be different for each family. And finally, can ADHD be outgrown? ADHD continues into adulthood in most cases. In some careers, having high energy behavior can actually be an asset. Adults with ADHD can lead very productive lives by developing their strengths, structuring their environments, and using medication when needed. Hopefully, this has helped give you a better idea of what ADHD is, how it's diagnosed, and how it's treated. If you'd like more information, please go to healthychildren.org or talk to your pediatrician. Thank you for your time and attention, no pun intended, and hope to see you in person again soon.